Hi there. In this video, I'll be talking about working with culture in psychotherapy. Cultural experiences and factors are crucial in psychology, and skill with navigating cultural issues is becoming ever more recognized as a core competency for therapists. I will give 3 general ideas for thinking about culture in therapy, plus a practical suggestions for working with cultural issues in the early stages of therapy. If you want to see more videos like this one, be sure to check out the rest of this channel. You can like, subscribe, and hit the bell icon for notifications. As for me, I'm Dr. Silvain Dang, a member of the San Francisco Psychotherapy Research Group and a registered psychologist in Vancouver, British Columbia, Canada. If you're living in British Columbia and want to check out my private practice, the link is in the video description below. Some of the concepts I'm discussing here are based on a model of therapy called control mastery theory. We've created an ebook to explain this approach in more detail for those who are interested, including clinicians and clients. If you want to check out this ebook for free, you can also do so in a link in the video description. For this video, I will also be drawing on work by Daryl Wing-Su, Celia Falikoff, and Pamela Hayes on cultural competence, John Barry and Andrew Ryder on acculturation, Gloria Anzaldúa on borderlands, my own research on the relation between Chinese and Western culture and sexuality, as well as the many mentors and clients I've had the opportunity to work with in my career. The first idea about culture and psychotherapy I wanted to share with you is that culture always matters. Culture is not just something we think about for other ethnicities or other races or people who look or act differently than us. The truth is, we all exist in a cultural context, whether that's a mainstream Canadian or American or Western context, or another cultural background that we might have. Culture is something that exists within us in the form of ideas, information, stories, and identities that we've picked up in our lives. It's also something that exists around us in the institutions, the politics, the economics, and the relationships in which we inhabit. For example, when working with clients of a white Euro-Canadian background on sexual concerns, oftentimes we end up talking about how sex and sexuality is framed from a mainstream Canadian or perhaps a Western or Christian cultural context. We might explore which aspects of this culture has served the client well and which aspects may have had a harmful impact. The idea that culture is everywhere around us and within us means that psychotherapy itself is a cultured endeavor. And no matter what we do, it has a cultural context and a cultural history. As one of my mentors in internship said, psychotherapy is a healing tradition among many other healing traditions that exist around the world and has existed in history. It may happen to be the one that we really like. It might be the one we think is really effective, but nevertheless, it is just one, and we must have the humility to acknowledge that. The cultured nature of psychotherapy also means that we have to consider the context and history that led the client into stepping into our therapy room. For example, when I work with people of a Chinese cultural background in Vancouver, it is not enough that we only give consideration to their Chinese heritage culture, but we must also identify the important elements of Canadian culture that they've connected with or that they feel disconnected from. We must also give consideration to the migration history of themselves and their families, such as whether they have been living in this land for many generations, if they were born locally to the first generation immigrants, or if they themselves were recent immigrants or immigrants at an earlier time in their life. We must also give consideration to the fact that the very act of migration, that of packing up one's life and moving to another part of the world, and the challenges and barriers, the promises and hopes that this act might represent, as important to the client's experience. This can include dealing with experiences of being in the cultural minority, of facing discrimination and prejudice, of limited financial means, of familial expectations, of losing or missing out on key connections at their place of origin, of traumas and hardships in their place of origin that those in their destination will not understand, and the struggles and the promises of forming new connections in their new home, all of which can shape a client's identity and present significant challenges, as well as opportunities for resilience and striving. One significant experience for some bi or multicultural clients I have worked with is one of alienation, of feeling like one doesn't belong in their heritage culture or cultures, nor do they belong in the mainstream culture. At the same time, this experience might also represent opportunities for integration, of combining the best parts of multiple cultural backgrounds to create something that's more meaningful for the client that wouldn't have been possible otherwise. My second point that I wanted to discuss is that of cultural humility. I use this term to highlight the fact that we, as clinicians, can never be truly competent about culture in all of its ways, or know and be able to skillfully navigate every single culture that exists in this world. In fact, I would argue that we can never be truly competent in navigating any culture, including the ones that we ourselves live and have grown up in. After all, how can any of us really say that we know how to effectively navigate every single aspect of our social world and communal existence? What this means for us as therapists, then, is that we must take a lifelong commitment to learning. This includes reflecting on our own cultural biases, the narratives and practices that we have learned in our lives, and thinking about which ones have served us well and which ones can get in our way, and whether which ones serve us well and which ones get in our way might depend on the circumstances and the people that we're trying to connect with. We must also extend curiosity towards the cultural experiences of others. Curiosity about how and why things are done the way they are. Curiosity about what makes something important or not important to another person, regardless of whether it's culturally normative or not. When working with our clients, this also means we must be curious about their experiences, including how their experience and interpretations of both culturally normative and culturally non-normative parts of their lives are integrated in their minds. This practice of curiosity can also involve having enough of a baseline understanding about the ideas and discourses important to a certain culture or a person of a certain cultural background to engage meaningfully with the client's values and experiences. For example, when thinking about Chinese people and Chinese culture, one idea that comes to mind is that of filial duty, the responsibility of a child to their parents, to their families, an idea that's often attributed to the ancient Chinese philosopher Confucius, and one that is very important to many Chinese people. However, what can get missed is that Confucius said a lot about many matters. He talked a lot about the duty of families, of parents, to provide care and support and nurturance for their children. This point can often be missed by some clients who are carrying painful pathogenic beliefs stemming from the traumas in their own upbringing. What might also be missed by a simple understanding of Confucian ideas is that Chinese culture has a vast array of other philosophers and other writers who've provided many other perspectives. This includes historical and contemporary Chinese authors who've harshly criticized what they see as the limiting and harmful aspects of traditional Chinese culture. So, which of these ideas and which of these perspectives I'll pull out of my toolbox, of course, depends very much on the individual client and their needs. In the ideal world, we would know enough about all cultures to have these types of nuanced discussions with any client. In practice, this might be something we aspire to, something that we challenge ourselves when we want to learn more or when we try to learn more about the world. At the same time, we, of course, put more focus on learning about the cultural context most important for our specific clients and to the communities in which we serve and in which we practice. At this moment, it's also important to keep in mind that as therapists, our clients are not our sources of professional or personal development. After all, they are here to get help for their particular needs and difficulties, not to serve our curiosities or our needs to learn. That means we have to do our own readings, our own continuing education, consultation with our colleagues, seeking and reflecting on our own lived experiences, and so on, so that we can keep informed about the world that we live and practice in and the communities in which we do so in. In fact, for some clients, it may be incredibly important for them to not have to be a representative or a spokesperson for their culture. This is a challenging role that individuals of cultural minority groups often have to take on in other aspects of their lives, and they may be very disserved in having to do so in the therapy room. My final broad idea is the importance of individual experience and common humanity. We absolutely cannot view people of other cultures as a homogeneous group with homogeneous concerns. Any cultural group is as diverse and heterogeneous in individual experience as our own. Each person within any group will likely have some culturally normative experiences and some culturally divergent or transgressive experiences. We must also be considerate towards issues of intersectionality when thinking about culture. That means giving consideration towards factors like gender, sexuality, socioeconomic circumstances, age, physical and mental health, and what the person might have gone through individually in their own unique life. The most nuanced consideration of diversity is the individual experience. An example of this can be seen in the experience of being Chinese and being LGBT or queer. Connecting with Chinese culture can be a really useful protective factor for many Chinese folks here in Canada. But this carries a very different meaning depending on, for example, if you're gay or straight, due to the homophobic attitudes often seen in traditional Chinese culture. This can mean that navigating heritage culture may be less available or more challenging for sexual orientation minority individuals. It becomes less reliable as a tool for stability and might create painful disconnects between the client and their families and other loved ones. This also means, for some clients, an experience which validates both their cultural and sexual orientation identities may be especially powerful and healing. In practice, some clients will want you to honor cultural differences and culturally bound experiences, while others will not want you to focus on these matters. Different clients will need different corrective emotional experiences. Perhaps some will benefit from learning that their cultural experience can be a really important source of strength. Perhaps others will benefit from learning that their cultural experience contains significant traumas. Perhaps some will need you to reach beyond the barriers and confines of culture and be able to connect with them as a fellow human being. And perhaps others will need you to see their cultural experiences and celebrate with them the identity that they've found in this world. In the example from earlier about being Chinese and being gay, different clients might want and need very different kinds of support navigating this type of issue. One client may wish to form stronger relationships with their family regardless of perspectives on sexual orientation. Another client may need support and validation in stepping away from their family so they can live the life that they truly want. A third client may need support in building or finding a community that honors their experience as both a Chinese person and a gay person. And a fourth client might have concerns completely unrelated to these parts of their identities, but simply require that you know this about them so that you have a foundation for understanding some aspects of their experience. For the clinician, this means that at times, walking a fine line between supporting and validating the client's connection with their cultural background, at other times, challenging their culturally learned experiences and narratives, and at other times, recognizing the needs and traumas that are perhaps even outside the scope of culture. So those are the three ideas again. They were culture always matters, cultural humility, and common humanity. I did promise you one more practical tip on working with culture early on in the therapy process. In control mastery theory, we expect patients to engage in what we call testing to try and get their needs met in therapy. If the client perceives a cultural difference or disconnect, it will likely become part of their early therapy testing. In these early tests, clients are often engaging in behaviors and then being very attentive to your response because they're trying to figure out if you are credible and if the environment you've created in the therapy room is safe. If so, that will allow them to perhaps explore some very challenging and very unfamiliar issues. This is particularly key if the client has a cultural background where mental health, psychotherapy, and disclosure of vulnerable feelings are not normative. This is also key if the client has faced violence and exclusion related to discrimination and prejudice. Some examples of common testing themes in this regard might include questions of, will you help me or will you hurt me? Will you accept me or will you reject me? Will you understand me and see what's important to me? Or will you only see me as a stereotype or caricature? Do I have permission to act and experience differently than what's been keeping me stuck? Or will I be expected to enact a pattern that hasn't worked for me? To pass these tests, we can be sensitive to a client's coaching. Essentially, the client providing us with information or perhaps hints on what they need. Some areas to pay attention to for potential coaching around culture can include a client's spontaneous utterances and descriptions of their cultural background, including whether they label something specifically as cultural versus leaving that part unsaid. For example, a client might label an experience as culturally bound to encourage you to help them navigate the experience, perhaps discouraging you from challenging or questioning the experience, perhaps hoping that you will be curious about some aspect of it, perhaps hoping that you will tread lightly and be careful with some aspect of it, perhaps in hopes that you can appreciate the impact of a culturally bound experience on them, or perhaps so that you don't think that they're weird or bad for having a different experience of something than what they think you might expect. When thinking about coaching, we might also pay attention to a client's affect and feelings around descriptions of cultural experiences, whether they overtly label them as cultural or not. We might also be paying attention to how other people have interacted with them, for better or worse, around issues around culture. I find that a client reporting on how other therapists have navigated these issues, whether it was in a helpful or an unhelpful, or perhaps in a neutral way, at times to be particularly useful in me building an understanding about the client's experience. We might also pay a lot of attention to, of course, how they respond to any overt questions about their cultural or ethnic background as part of your standard history taking. Early on in therapy, all clients, and especially clients who are not culturally familiar with psychotherapy, are doing a lot of work to try to adjust and attune themselves to the therapy situation. Remember, again, the focus is on safety and credibility on the part of the therapist and the therapy environment. If the therapist can pass these early tests, it will allow the therapy to be seen as a safe environment and the therapist to be seen as a credible ally in the patient's care. It will facilitate the deepening of the therapeutic alliance and allow for work on further key issues, whether cultural or otherwise, for the client. So again, testing around safety and credibility is something incredibly important for a therapist to pay attention to when thinking about culture in the early stages of therapy. So that's all from me for today. Culture, of course, is a huge topic, and today's video only barely scratches the surface. If you have specific topics or questions about culture and psychotherapy that you want to learn more about in a future video, please leave a comment below. Thank you for your time. We post a new video every Sunday. Be sure to like and subscribe if you want more.